sir. We shall now go on to our next speaker, Dr. Neha Dholakia, who is going to be presenting a novel ultrasonic intraocular lens cutting tip and IOL holding forceps. On to you.
Play, Kari. Please play.
Dr. Neha Dholakia presents the IOL cutting tip and forceps. Broken IOL complications have been the most dreaded for years. We've been using techniques that are tedious and traumatic to the wound and the endothelium. The snare technique, which cuts the IOL into two halves, the twist and out technique, which requires a swift and skilled surgeon and can stretch the incision if not performed properly. IOL explantation through a cartridge, which needs force and can stretch the wound out. Crocodile scissors, which are bulky and cause rocking of the IOL and endothelial damage, and thereby getting post-operative striate keratitis and even a Descemet's detachment at some time. Introducing this innovative tip, which makes it easy for any surgeon to cut the IOL extremely easily into 3 or even 4 or even 5 parts. Each sliver is only 2 mm in width and hence can be removed easily and gently through a 2.2 mm incision without stretching the wound or extending the wound at all. The reasons for explantation are broken haptics at the time of insertion of the IOL, an unhappy patient due to halos and glare, especially in ringed IOLs, refractive surprises, dislocation or subluxation of the IOL. Now the tip is a stainless steel tip which is designed after many attempts to get the length, breadth, angle and sharpness right. The phaco probe has to be primed just as usual with the normal tip, and then the tip is removed and the IOL cutting tip is screwed in and tightened, and then over it the sleeve has to be attached. The forceps are such that the jaws of the forceps open and close vertically just like the mouth of a crocodile, but the grip is such that it is horizontal and open and close parallel to the ground between the thumb and the middle or the index finger. It is ergonomically designed for ease of use. The surgeon introduces the forceps through the side port and gets a good bite of the IOL. Then the surgeon positions the tip and simply presses on the foot pedal. The vacuum and aspiration are at 0, irrigation is on but low, power is between 20 to 50, that allows us to cut any hydrophobic or hydrophilic IOL with ease. As you can see here, the IOL is cut just like butter, so easily within 1 second. And the pieces can then be removed through the incision without extending the wound. This is an in vivo demonstration of the same. The IOL is being cut into slivers of 2 mm each, and each sliver can be removed without stretching the wound. The pieces have to be aligned parallel to the incision such that each piece can be removed efficiently without damaging any part of the eye. Advantages over the other techniques: can easily explant the IOL without extending the wound at all. There is no tilting of the IOL like with the scissors. There is no stretching of the wound. No special surgeon skills required. One can cut the IOL into even thinner slivers if the need be. All in all, this technique uses the ultrasonic power of the phaco machine and removes the IOL, respecting the posterior capsule, the wound, and most importantly, the endothelium. Thank you very much.
That was wonderful. I would ask Dr. Ellen Kumaran to take the question.
Ma'am, that was a very good
The next speaker
video.
is Vignesh.
But my questions now, many people are using it, I presume, right now.
Yes.
What about the complications that have been noted?
So touchwood, till now I have got videos from so many doctors. This was made before. I have that video with other. Nobody is getting SK the next day. Everybody is getting 6/6 vision. I'm getting a call almost every second day from some part of India. Thank you so much. It was extremely good. Yesterday, Dr. Ashish Vaidya from
Dr.
Bombay
Neha
called.
Dholakia.
Volume off. Volume off, Lakshmi. So I have some videos of that also.
No, ma'am. That's okay.
with them showing the post-op and everything.
Okay.
And also the hardened IOLs, which are opacified, they are very difficult to cut with the scissors.
yeah.
This actually strangely cuts that more easily. Maybe.
And the chamber
So,
is
but the
maintained.
hardened IOLs, opacified IOLs are largely hydrophilic IOLs.
Yes, yes.
So they can actually be removed easily without enlarging the incision.
Correct, correct.
So
No, but I think when a hydrophilic IOL is to be removed normally,
Yeah.
it's easy. But when it gets opacified, it becomes little stiffer. That's
Yeah.
what everybody else is removed, because I just made the innovation and removed one IOL. Then everybody
Yeah.
else has done that. Hard PMMA, no, sir, no. And it can be attached to any phaco machine. And
what is the
used.
parameter you set on it?
So vacuum 0, aspiration 0, irrigation flow on, and we've been able to cut IOLs with 20% power. So 20% power in the anterior chamber for like 3 seconds, it doesn't cause any
Yeah.
damage.
Cost of tip?
No, I have tried other techniques, but I think the scissors opening and closing, which are the Packard. Endothelial count, I think vision next day is 6/6 crystal clear cornea. Huh. Scientifically not counted endothelial count, sir. Yes.
Thank you,
Thank
Neha.
you.
We should go on to